What's up, YouTube land world? It's me, obviously. Today I'm in a little different setting. All the lighting in my house kind of is horrible, so I figured I'd rather be outside and have really awkward lighting than be inside and have no lighting at all. I am back home for the summer, so obviously there's gonna be some new backgrounds. So get ready for it. Today I'm gonna talk about a new form of medicine that I have recently started. As some of you may know, I have been taking methotrexate in pill form, and now instead of taking 10 milligrams a week, my doctor thought it would be best if I took 25 milligrams a week, or it's also known as 1 milliliter. Now you can't take 25 milligrams in pills because it is unsafe for some ungodly reason. So you have to give it to yourself in the form of a shot or a self-injection. So you give it to yourself once a week. So instead of taking the pills, I give myself a shot. And I've given myself 3 shots so far, and it has been alright. Side effect wise, I thought having shots was gonna make my nausea and my tiredness worse, but actually my nausea has been actually better. In the past few weeks I've been taking the injection form of methotrexate, so that's kind of awesome. So I just kind of want to make this video to give you guys information if you yourself are about to make the switch to self-injections from pills. I'm still taking 30 pills a day and I still get my Remicade IV infusions, but now I do self-injections once a week. It kind of makes me feel like a badass sometimes because I'm like, yeah, I just gave myself a shot. I am so cool. So I'm just gonna make this video, give you guys some information, and maybe make some of you more relaxed if you're about to go into the self-injection route and you are scared out of your mind. So symptom-wise, the higher dose of methotrexate has been helping me phenomenally with my ulcerative colitis symptoms. Side effect wise, with the pills I would get very nauseous throughout the week, and I was super tired for a day or two. You kind of feel kind of sick and drowsy about first few days after you take your methotrexate. But that was in the pill form. Injection form, not only am I not as tired after I take it, but the nausea is so much better. I think maybe a few times a week I'm gonna suffer from nausea versus every single morning and every single day of the week. So that's been great. The main symptom I've had from my injections is right after I take my injection. That's when I get nauseous, but I do it right before I go to bed, and then I take Benadryl. My nurse told me take Benadryl after you take it. It helps you get to sleep, and it helps you when you wake up, you're not gonna feel very nauseous. So that helps me a lot. Right after I take the injection, sometimes I'll get stomach pains, abdominal pains, but those usually go away within 24 hours of giving myself the methotrexate injection. Basically, the big differences for me, a lot of people have different symptoms. Some people have more side effects from the shot, and some people have more side effects from the pills. For me, I do like the shot better so far. I'm gonna kind of show you what is going on. I filmed myself giving myself the self-injection, and I'll have little tidbits of it on one of the sides of the video as I'm kind of explaining what you do, so you can just kind of see what I do. And I did give it to myself last night, and I woke up this morning not very nauseous, and I'm doing pretty good. A little tired, but hey, I mean, it's what can you say? Basically, when you pick up your methotrexate from the pharmacy, my pharmacy anyway, gives you to you in this giant medicine bottle, and inside are the little vials, and I'll show you what one of the vials looks like. Looks like this. If you can see, the liquid is like a yellowy color, and they give you 6 at a time, and basically this is 2 weeks worth. So if you use half of this, that's for 1 week, and then the other half is for another week. So then you can basically, when it's time to give yourself the injection, you flip off this blue top, and then I actually have an empty one to show you. Is that gross that I saved this? This is what an empty one looks like. There's still a little at the bottom. Without the blue top, this is what it looks like. It's just kind of a metal, and you see there is a dark gray little circle thing, and that's what you need. And when you first flip off the top, it's gonna be completely sanitary. Basically take it, and then that's what your little vial looks like. And then you get a prescription for your syringes too, which I thought was really funny, but I guess they're trying to be safe. This is what the syringes look like. It's like this. They're 1 milliliter, 25 milligrams. And yeah, it's pretty cool. So what you do is you take off the little orange part, and don't think this is gross, but this is one of my used ones. Sorry, I think the camera fell, so I'm sorry if my head got cut off the shot. This is what it looks like after you pull off the little orange top. It's super small, and yes, don't think this is gross. I would never use this twice, and I am disposing of them properly. Don't freak out, I would never stab anybody with this. Anyway, so this is what your needle looks like. And then this didn't come with it when I picked it up at the pharmacy, but my nurse gave me a bunch of alcohol wipes, like a billion of them. Need these. You use at least, I use about 2 every time I give myself an injection, and that's what you basically need. So I'm gonna kind of talk you through how I would give myself the injection, and like I said, there'll be random videos up there somewhere in this video while I'm talking kind of me giving myself a shot and what I do to do that. So basically, what you do first is you wash your hands. You're gonna wash your hands like 3 or 4 times. I swear, you have to be clean. Now there's this huge truck, I'm sorry. I should wait till it leaves. That UPS man. Okay, when you are ready to give yourself the shot, I always do it at night. I get all ready for bed, I do everything I need to do, and I give myself the shot right before I'm about to go to sleep. Because as soon as I give myself the shot, I take my Benadryl and I knock out. So what you do, wash your hands, and then what I do is I find a comfortable area. I stood up for the video, but what I usually would do is sit on my bed. What I do is I get a paper towel, place it over whatever, my workstation or whatever. I place my paper towel down, and I take out everything I need. I take out my vial, I take out my syringe, and I take out my alcohol wipes. So basically, first what I do, my hands are all clean, just saying. Then I figure out where I'm going to stab myself. What you're supposed to do is you're supposed to alternate one side of your stomach, other side of your stomach, and then one thigh, and then your other thigh. So your injection area is going to kind of alternate to kind of give your body a break and kind of mix it up a little bit. I gave myself a shot on the left side of my stomach, and I prefer stomach shots. They're super easy. And you give yourself the shot by like pinching your skin and using like the fat or whatever, you know. That's where you're going to be giving yourself the shot. It's no, you don't have to find a vein or any of that crap. You take your alcohol wipe and you clean the area that you're going to give yourself the shot. After you do that, then you're going to grab your vial. If it's your first time using the little vial and this top hasn't been taken off, then you're going to flip off this top. If you're using the vial a second time because you already used the first half of the vial the week before, you're stuck with this. So guess what? Get your other alcohol wipe and make sure to wipe off the area and make sure that it's all safe and clean and happy. Next, what you're going to do, take your brand new syringe. Do not reuse syringes or you will die or something close, probably. Take your syringe, you're gonna peel it out of your little pocket. And then what you're gonna do is hold it, clean hands. Take your orange thing, pull it off, and you have got a fresh needle. It will look like this, okay? This is dirty, just letting you know. I'm not going to stab anybody with this. I even bent the little knob so you can't really use it as a needle. I'm sorry, my camera died, but I am back. So basically what you do after you take your clean vial, your clean syringe, you basically stick your needle of your syringe in the little dark circle, stick it in, flip it around, and then you're gonna pull this down. So you pull it down to the measurement that it needs to be at. Then you pull it out, and then what you're gonna do, get your injection site ready, inject yourself with the needle, and slowly push the medicine in and pull it out, and then it's a good day because you did it. So after that, you're pretty good. Then I just take everything, I throw away what I need to throw away, I put everything where it needs to be. All my syringes and alcohol swabs go in this bag. Always keep it together. I've heard of methotrexate injections that do come pre-filled, and also I've heard of ones that you do have to have refrigerated, but these ones you don't need to be refrigerated. I just probably would recommend like keeping them in your car for like a few days on a hot day or something. I don't know, just common sense. Be careful. And like I said, side effects are better and symptoms are getting better. Little mini update. I am starting to wean off prednisone again. I'm down to 5 milligrams and I'm doing that every other day right now. Then I'll do it every other day and then I will stop, and I'm hoping that the methotrexate mixed with my IV infusions mixed with all my other medicines will make me be off of prednisone, because that's the #1 goal right now, because I have been on it way too long. I think it's been about like a year and like 3 months I've been on prednisone. So that's happening. We're basically just hoping the methotrexate will also help my Remicade last longer, because my immune system is so hardcore that it is pushing the Remicade through my system very fast, and so it's not really doing what it's supposed to do, which is to lower my immune system and make me better. Methotrexate is used for lots of things, whether that be other autoimmune diseases like rheumatoid arthritis and stuff like that. It's also used as an anti-cancer medication like chemo, except if you're getting chemo, you're getting a lot more of this into your system than we do if we're taking pills or injections. That's kind of where I'm at now. So I've been doing well symptom-wise so far, and things are going pretty great. There'll be another video up this week talking about my big announcement of something that is gonna happen next month that I'm really excited about. So that's pretty cool, huh? Yeah, alright. I bid you farewell until the next video, and I hope this was helpful. Again, if you have comments or questions or anything, you could always comment down below. You can always message me, and don't forget to like the video because that makes me happy. I hope you are all doing well, and I hope you are all having a great day. Bye!